that fine?
Yes, that's perfect.
That's my scarf. Look, is it okay?
Yeah, perfect.
You made me laugh. You made me laugh. Is this okay?
Hi everyone, welcome to the HugsNotDrugs YouTube channel. Today's video is very exciting. We are joined by 4 lovely ladies who will be telling us all about cannabis, cocaine, ecstasy and heroin. These drugs are used quite often recreationally, so we're going to find out a lot about them, find out some common names for them, maybe some you might have heard, some you might not have heard. We're going to be discussing how the drug is actually taken, and then we will also be discussing some health complications that come as a result of drug taking. Here at HugsNotDrugs, we believe that it's important that we open up the conversation surrounding drug use, because then people are more likely to get help. A lot of research has shown that shaming someone does not actually make them want to go and get help. If anything, it makes them want to just hide away. I think it's important, if someone is struggling with drug use, that they do get the help that they need. So we will be discussing what pharmacies are doing to take a harm reduction approach. So a harm reduction approach focuses on not shaming an individual for taking the drugs, but in fact making it somewhat safer. I think as a society, it's widely accepted that drugs are illegal, you shouldn't take them, they're bad for you. But the truth is, people are using drugs. People are seeing drugs from a younger age due to social media, and just the world is quite small at the minute. You can access information from anywhere. And I think with drugs like cannabis being legal in different countries, more people are questioning whether or not the legislation in this country is appropriate for cannabis use. I'm a 4th year pharmacy student, and I can't sit here and say that I've never seen a drug before, whether that's legal or illegal. I think it's important to open up the conversation and create safe spaces for people to discuss these things, because a lot of people are struggling, and especially as future health professionals, we should be empathetic towards someone who might be struggling and who might need help. Having said that, personally, I don't think someone who is taking drugs is necessarily off the rails. Some people do just want to experiment. However, I think it's important to remind people watching this video that these drugs that we are going to discuss today are illegal in the UK. You can end up going to jail for possession or supply. As a collective, HugsNotDrugs would like to add the disclaimer that we are not promoting drug use in any way by opening up this conversation. We are just wanting to discuss it and try to create safer spaces for people. We are also not telling people to abstain from drug use. At the end of the day, I think people are going to choose whatever they feel is best for them. First off, it's important to discuss why someone might want to use drugs. This could be for various reasons. A lot of research does point towards the fact that someone who might have poor mental health is more likely to engage in drug use as a coping mechanism. However, this isn't necessarily always the case. Some people just enjoy taking drugs, they enjoy the feeling of it, and so they regularly engage in drug use. However, it's important to realise when something is becoming an addiction and when it is having detrimental effects on your health. And so therefore, we hope that anyone viewing this, or if anyone you know might be experiencing this, we hope that they do manage to get the help that they need. Also, if your mental health is poor, we would recommend speaking to a health professional before somewhat self-medicating and using illegal substances to help cope with that. There are a lot of alternatives to self-medicating. If you do get professional help, you can speak to someone, you could possibly start medication that is controlled and regulated. Whereas if you're taking something that is illegal, it's not really regulated, you don't know what you're taking, it can often make your mental health worse. So it's important to obviously speak to a professional before you do go on a journey of self-medicating, because you could end up in a worse position at the end of it. This video is not intended to promote drug use in any way. If anything, we are just trying to raise awareness that drug use is happening, and that these are some ways that if you are struggling, you can get help. Just know that you are not alone, and that this is a problem that many people are struggling with. However, it's quite taboo in society, so no one really wants to speak about it. Whether it's just minor drug use or it's becoming an addiction, I think it's important to obviously understand when it's getting too much and be aware that there will always be help out there for you, whether that is from a health professional or just a drug use organisation. I think the help is there if you need it, so we do encourage anyone who might be struggling, please reach out for some help. We will put some links in the description for organisations that you can access, whether that's calling them in or emailing or just reading up information on their websites. The help is there if you need it. So now let's start with the interviews. First we have Farah, who's going to be telling us all about cannabis. So Farah, what are some common names that cannabis is also kind of known as?
Cannabis, weed, Buddha, Mary Jane, pot.
So how is cannabis taken?
Cannabis can be consumed as edibles. It can also be smoked and inhaled.
And what are the possible complications of cannabis use?
Cannabis can be categorised as a hallucinogen, stimulant, and also a depressant. The short-term side effects include feeling relaxed, faint, and also hunger. Long-term side effects of cannabis include cancers such as lung cancer. It can cause addiction and dependency problems, and it can also cause cardiovascular disease.
So let's move on to ecstasy. Ecstasy is a common dance drug. It's often kind of seen in clubs and raves to enhance the experience. Some of you might have even been offered E. If you're out and about in club settings, it is seen there quite often. Compared to cannabis, which is quite social in my opinion, people often smoke it together, whereas ecstasy is quite a personal experience. So Rua, what are some common names for ecstasy that people might have heard of?
Ecstasy, Molly, MDMA, Clarity, Lower Speed.
How is it taken?
Ecstasy can be taken as pills, which can be crushed and snorted. It can also be used as a powder form, which will be placed into gums and in cigarette paper.
And what are the health complications of it?
Ecstasy can be classified as a hallucinogen and a stimulant. The short-term side effects include increase the feeling of well-being, increased confidence and paranoia. Long-term side effects include trouble concentrating, impulsive behaviour and depression.
An interesting thing with ecstasy is if you do take it, your body will feel quite thirsty and you will keep drinking water, and unfortunately a lot of people have died from actually drowning themselves because they have drank too much water and their body just doesn't know when to stop. So therefore, if you do happen to take it, to just be careful and be aware that there are obviously complications that you might not have ever experienced before. And so therefore obviously we do recommend that if you do ever choose to do any of these drugs, to just research a little bit. Don't just go in blind, because you will experience things that you haven't experienced before. So moving on to cocaine. Cocaine is a very popular drug across age groups. It can be found in like teens, adults, professionals. A lot of people might have taken cocaine before and you might not have even known. So Janet is going to tell us all about cocaine. So what are some common names that people might not have heard of before?
Cocaine, crack, dust, snow white, white powder.
And so how is it taken?
So how is it actually used? Cocaine can be injected, snorted, or even smoked. Some people might combine it with laxatives, as cocaine is an opioid that can cause constipation.
And what are the possible health complications from taking cocaine?
Cocaine is a stimulant which can cause euphoria, intense happiness, extreme sensitivity to touch, sound, and sight. Long-term side effects of cocaine include loss of appetite, which can lead to malnutrition, and cardiovascular disease, which can increase the risk of stroke.
A sad fact about cocaine is the fact that it's a white powder. It can often be mixed with other white powders. So for example, if you're buying cocaine in a small little plastic bag, it could be mixed with caffeine powder, baking soda, even worse drugs such as fentanyl, which is an opioid. This can then lead to serious addiction. This is seen in the States quite a lot, but We can't confirm whether or not it is common here. There isn't a lot of research on it, but obviously just be aware that this is happening and that it's important to just be safe, and you might not know what you are putting into your body, so just be careful. It's worth noting that cocaine and ecstasy are actually Class A drugs, even though they might not seem as worse as something like heroin, for example. They are still Class A drugs. The UK government views Class A drugs as the worst possible drugs, and so therefore they come with the highest sentences. So it is worth taking note of the fact that if you are caught in possession of them by a police officer, this can result in prison time, so just be aware of that. So the final drug we will be discussing today is heroin. So Nida is going to tell us all about the common names you might not have heard of.
Heroin, dope, smack, beast, snow.
I don't know if my age is showing, but I've never heard of beast before. Not quite sure about anyone else, but I don't think the word beast is really intriguing to me. It's quite scary actually. But anyway, moving on, let's find out how heroin is actually taken.
Heroin can be smoked, snorted, sniffed and injected. It can also be combined with crack cocaine, and that's a form of speedboating.
And so what are the complications that come with heroin use?
Heroin can be classified as a depressant. The short-term side effects are euphoria, a dry mouth and warm flush skin. Long-term issues include insomnia, mental health issues and lung complications including pneumonia.
I think as a society we collectively all condone heroin use. I think a lot of people are unfortunately shamed who are struggling with heroin use, and I think we should do more to offer help to them. And so let's find out what pharmacies are doing to kind of take on a harm reduction approach to help people who might be injecting drugs of any kind, and to find out if there's any way that we can all help.
So how can pharmacies tackle recreational drug use?
So selected pharmacies can provide a needle exchange service. This is where patients are able to come into the pharmacy and request needles through the needle exchange service, which allows them to swap out their contaminated needles. Usually a maximum of 50 needles are given. These are 1 ml syringes, and they can also collect on behalf of somebody else, which doesn't limit the access to the service.
So by this then, how are you not promoting drug use?
This service is not promoting use, it's promoting safe use. It's because it prevents health problems such as bloodborne diseases being passed on from person to person through contaminated needles. This includes infections such as HIV, and if this service was not in place, then contaminated needles would be disposed of incorrectly, which can cause needle stick injuries, and it can also cause the prevalence of diseases and infections starting to rise. So what if, for example, the local pharmacy near me doesn't provide the needle exchange service? Can people just walk into the pharmacy and ask for help? And how does the referral process work?
Yeah, so people can walk in and ask for help. Pharmacies can play a primary role in helping recreational drug use. Firstly, pharmacies can help those to actively seek advice and help in relation to their drug use. Secondly, pharmacy staff can identify those patients who present with signs and symptoms of long-term drug use. For example, a patient can attend the pharmacy with an administration site infection. These can occur as a patient who administers drugs such as heroin can have infections at their injection site due to prolonged use. The pharmacist will then be able to refer them to the GP, where they would be able to prescribe them with antibiotics. If necessary, the GP can also refer them to a rehab clinic where they can access professional help.
So what are buprenorphine and methadone, and how can they be used?
So basically these are called oral substitution therapies, which involves substituting injecting opioid drugs with oral medication. So this will effectively minimize cravings and withdrawal.
So how does the process of picking up methadone work?
So basically the patient on methadone, they have to pick up their methadone every day. This can be supervised by the pharmacist or unsupervised. But if they miss more than 3 doses, they need to titrate to a lower dose because they have lost tolerance at this point.
So if a patient comes into the pharmacy presenting with signs and symptoms of drug use, how would we tackle this?
So if the pharmacist suspects that the patient has been on an overdose or has been taking drugs, we would not dispense the prescription.
I hope this video has been really useful to help you learn about some commonly used drugs, and hopefully you have been given enough information to make your own decision whether or not you choose to engage in drug use or abstain. That is completely your decision. We are not promoting drug use in any way. If anything, we are just telling you about the possible health complications if you do choose to use any of these drugs. We are always going to promote doing your own research. If you intend on doing anything, I think it's important that you know as much information as you possibly can before somewhat going in blind. We hope that you have learned something from this video and that you can share it with others. I think it's so important to take a harm reduction approach, because unfortunately a lot of people are struggling with drug use, but they don't know where to go. They don't want to be shamed and just seen as just the worst of society. I think it's important to just open up these conversations so people can get help. At the end of the day, we are future health professionals, and so being people of service and to just provide general help regarding health is so important to us. We do hope you've enjoyed this video. If you have any more questions, you can contact us on our social media links. Everything will be in the description. Thank you for watching. Take care. Bye.